Welcome to HealthWise. With us is Dr. Jason Hatfield from the Harmon Medical Group. We were talking a little bit about where he was from, and we also talked about the food and how it affects us because we always overeat. Well, one of the things about overeating is high blood pressure. So, Doc, do you see a lot of that in your practice?
A large amount of it. I would say almost exclusively, but that would be a little bit of a stretch. But it is one of the foremost illnesses in the country. It's extremely common, and it's more common as we get into areas where diet and exercise may not be as big a part of the lifestyle as we wish they were. Food intake, overeating, obesity, all of these things play a role in blood pressure. We know that stress and anxiety, these types of things do as well, but there's also a large genetic component, and that becomes worrisome because as you get into areas where, the families have been there for a lot of years and it's a well-established community, then those genes are kind of hanging on, and blood pressure starts to affect multiple generations, and it's important that we get that under control because the consequences can be pretty severe. Stroke, heart attacks, coronary artery or heart disease, all of these are very common problems that we're all fairly familiar with, whether it's personal or some relative down the road or at least a friend that may have had problems with it.
Okay. Doc, as far as high blood pressure, is it more prevalent among women than men or what?
It's a pretty equal split. It seems to be pretty equal split not only among the sexes but among different races. There are, different medicines that can sometimes be more effective in certain people. There are different genetics that can sometimes play a role, but overall we see it equally in all types of people.
Okay. Well, first of all, I guess we need to tell the audience if they suspect, or do they need to come to you, or can they rely on these, what do they call the high blood pressure, the ones over the counter?
Just the at the pharmacy or
right.
the home blood pressure cuffs. You can rely on them to a certain extent. They're in most cases not as accurate as those that you may have in a hospital setting, even in the EMS setting, but they're a good guide. And what I'll usually tell my patients that either use them exclusively or those that I recommend use them is that they follow the trends.
Okay.
If you're seeing a certain number every day, and then in a few weeks later you start to see a large spike in those numbers and a difference, then that's concerning. That's when you want to be concerned. I'm not so much worried about the exact number as I'm worried about a deviation, a change from what the trend is. And then when we get you into the office, we take a look. We generally don't diagnose high blood pressure after a single visit, with extreme exceptions. If you're coming in and your blood pressure's 180 or 200 or more, then we're a little bit more concerned about high blood pressure and getting you treated immediately. But if you're in that 140, 150 range, kind of that area where we're still concerned maybe what you ate that day, stress level, just seeing the doctor, something we call white coat hypertension. If that's kind of in that range, if the blood pressure's in that range, then we want to get you back again and confirm that reading. I try to make sure patients know that I don't want to push medicines on them. I don't want to start treating them or diagnose them with an illness until I'm absolutely certain. And part of that is making sure that we're able to check that blood pressure on 2 separate occasions. And then from there, if it's confirmed, then we have to start talking about how to treat it.
Okay. And once again, if we have to start talking how to treat it, before we talk about that too, because you did mention that, the numbers. Which number for the audience is considered high blood pressure?
Well, we're talking about 2 separate numbers, systolic and diastolic blood pressure, and that's related to the way the heart pumps and the pressure that's associated with the pumping and the relaxation of the heart. But the systolic and diastolic, and we're looking for numbers above what the average person hears is 120 over 80, and we'll generally give 10 points in either direction. So 130 over 90, higher than that, then we're concerned, and if you start running lower, then we're a little bit concerned, but not for medication-wise, just something to monitor. But above 130 or 90 is generally what we consider.
And why would a person have high blood pressure? What exactly is in layman's terms, what is the cause of high blood pressure?
Well, in most cases, there's not a definitive cause, meaning it's not related to directly to their diet, to their lack of exercise, to their weight. More often than not, it's a genetic cause, and it's what we call benign essential hypertension, meaning we don't know exactly what's causing it. It's just that it's there. That can change with age. It can change with lifestyle, certainly, and those are things that we want to try to adjust if we can. But there are other secondary causes of hypertension, kidney issues, heart issues, those sorts of things that can play a role. But mostly it's just, unfortunately, the cards most people have been dealt.
Okay, all right. And you also see all these commercials for all these different meds, these pills. They show pictures of plaque in the arteries and all that stuff. Well, we'll wait till we come back from our break before we get into that, because I want to give you time to talk about that. But you were saying that it really is just not, you don't see any more men or women. So it's just anyone could have high blood pressure.
Absolutely. Even children, unfortunately.
Right.
And
you're probably seeing a lot of that now.
I've seen some. We're tending to see more because of the obesity epidemic that's affecting the country, including our children. It does become a concern. I've even seen a case or two since I've been here already. So it is something that we should be concerned about, mostly in adults, but definitely in all ages.
Okay. All right. Well, we're going to take a brief break for our sponsors, and we'll come back and we'll talk some more about high blood pressure.
All right. Sounds good.